Welcome to my educative channel. Today I'm going to talk about African patient upper blepharoplasty. I specialize in general surgery, reconstructive surgery, aesthetic surgery, but also in minimal invasive procedures and in laser technology. I'm going to summarize 25 years of experience using laser and using blepharoplasty and periorbital rejuvenation without skin resection. This is the conventional resective blepharoplasty that take 80 years ago, and this is the resection, and this is the marcation of the Mayo Clinic today. As you can see, from 80 years old and today, nothing has changed. It is the same resection with which blepharoplasty began. This is the skin resection. This is all the skin was resected, the upper eyelid fat pad and the stitches. Nothing has changed. It's the same procedure. But sometimes they are using laser, but they don't use laser for rejuvenation. They use laser for cutting and coagulation. This is what I propose. A minimal incision here, the removal of fat pad. Here you can see how I take out the fat pads, and here all the fat pads upper that I remove from this small incision. The upper eyelid is tightened with carbon dioxide laser in this way. The lower eyelid malar area is tightened with carbon dioxide laser in this way. And full face laser rejuvenation is performed in this way. Okay. Today I'm going to treat this patient, and this patient this is sagging skin here, and also have a lot of fat pads in the upper eyelids. The problem is this kind of patient, okay? This kind of patient have bad cicatrization, bad scarring. They produce sometimes this kind of hypertrophic ankyloid scar. What I propose to this patient is remove the upper fat pad through this small incision and tightening the skin with carbon dioxide laser. But everybody knows that if I use carbon dioxide laser for tightening the skin, the main side effect is the hyperpigmentation. And we can have hyperpigmentation in a white patient. In a black patient, the hyperpigmentation will be higher. Okay, let's see. This is the pre-op. We can see the sagging skin here. The conventional resective blepharoplasty is going to have a long scar here that we are going to know how it's going to be scarring or cicatrization. We can see this patient have also hyperpigmentation in the lips. And here we can see the fat pads in the sagging skin of the upper eyelid. You can see in a closer view, we can see the sagging skin, upper fat pads, here, here, here. You can see the skin, and also the eyebrow skin is sagging. The conventional resective blepharoplasty is going to leave a scar from here to here. You can see the sagging skin, a lot of sagging skin. This is the way I remove all the fat pads through a small incision. Have a lot of ability to take a patient around the world and to my clinic to be operated in this way from Europe, United States, Asian people, and also this African patient come from the Congo to be operated with this technique. This is 24 hours. This is 7 days. This is the hyperpigmentation that I told the patient that is going to happen. You can see the skin here is black, but here is blacker. A severe hyperpigmentation, but also you can see no scar and the tightening of the skin. No scars and hyperpigmentation. You can see the difference between here and here. This is 3 months with the patient with makeup, but also you can see in 3 months that have no difference between the upper and lower eyelid skin from the other sides of the skin. You can see the retraction of the skin, no scars, and you can see after piccolo laser treatment, you can see the difference between this skin and this skin. The skin that was blacker is this, and now is whiter. You can see the big difference after several treatments, I think so 6 sessions, 15 days, but also you can perform each week. No problem, because the piccolo laser have no side effect, no irritation. No scar, tightening the skin, whiter, and this is the difference between pre and post. You can see the sagging skin here and the tightening that carbon dioxide laser produce in the upper eyelid. You can see the big difference from here to here, no fat pads, a good retraction. You can see the sagging skin here and how the skin will retract with carbon dioxide laser and without fat pads here. The contraction of the skin, here you can see upper fat pad, you can see no upper fat pad, the retraction of the skin, and this is the energy that I use with piccolo laser. I use these hairs because I use laser since 25 years, but for the beginners I recommend to use 2-3 hairs that take time to move softly, because it's the eyes there, but I use in very high hairs. And this is the fluency. I begin with low fluency, but when the pigmentation go out, I increase the fluency. And this you can see the difference between the skin here and this skin. The skin that was blacker or more black now is more whiter, and no scar. This is the reason why people around the world come to my clinic, and at this moment no medical doctor are doing this procedure. No, because to remove the upper eyelid fat pad they are not able to do, but to get this kind of retraction take many years of using laser technology, and also be able to whiter this hyperpigmentation also have a long time of experience. And you can see the eyeball is under the skin, but if you use carefully, no problem at all. Here we can see a video showing the difference between the upper eyelid skin and other skin of this patient. You can see also in the lower eyelid have less pigmentation, the other side of the of the face. You can see in the other side, no scar, whiter, no fat pads, no side effect, no scar. It's very good, this procedure. And the patient was so happy that now want to depigmentation other side of the face and the neck. I hope this video helping you and you use this kind of technology. Have a nice day.